Suicide is the second leading cause of death for young people aged 10 to 24. And a lot of people don't realize that. And a lot of them visit the medical setting for, primary care or emergency department visits or inpatient medical care. And what we believe is that's a wonderful place to capture kids at risk. When you look at death registry studies and you study people who've died by suicide, what you find out is that the majority of people who have died by suicide have visited a healthcare provider months before their death, which means that's a wonderful opportunity to capture people at risk. The problem is that people, especially kids, don't walk into their doctors and say, I'm having these thoughts of suicide. And if somebody doesn't ask them directly, they're not going to talk about it. They're at the doctors to talk about more medical complaints. And so if we can have nurses or physicians ask kids directly about suicide, maybe that's an opportunity for the youth to speak about it for the first time and then to get help. When you ask kids, do you think nurses should ask kids about suicide when they're in the hospital? The majority of kids say yes. And they're not even just neutral about it. They say, this is a good idea. This is a good time to talk. When you ask me if I'm thinking about suicide, I think that means you care about me and my thoughts. And so they believe this is a way kids can get helped.